Welcome to Vidya's Kitchen. Today we have four very special guests who are going to talk to us about building resilience in children via positive parenting. All my guests are moms themselves and they are professionals in various fields and sport different skills and experiences which will contribute to today's lively discussion on this ever so important topic. I'm going to ask the guests first to introduce themselves to you, our viewers. I'm first going to ask Saraswati Narayan. Saraswati, if you may unmute, please, to introduce yourself, please.
Hello, I'm Saraswati Narayan. Right now, I'm based in Bengaluru in India, but I've spent all my working life in North Yorkshire and in Leeds. Um, Vidya and I have known each other a while. I'm here with two hats on. One is as a primary school teacher in Leeds and Harrogate, Knaresborough, and another as a mother of two young men who are now in their 30s. So I have sort of seen the end of the tunnel. I've been through it all. Haven't got all the answers. I didn't always get it right. So I'm hoping to share, not talk at you, but to maybe share some of the things. So hello everybody.
Thank you, Saraswati. Next, may I ask Shobha Shivram, Dr. Shobha, please, to introduce yourself.
Hello, good morning, everybody. I'm Shobha Shivaramakrishnan. I'm a consultant pediatrician, working with children with neurodisabilities, so with children with autism, ADHD, other difficulties as well. I've been in this field for many years now. I'm also a keen exponent of yoga, and I do mindfulness training as well. And because I've seen many trainee junior doctors leave their jobs and take some other careers and leave halfway. This has happened more recently. So I've started some training for them on health and well-being in workplace and how to look after oneself, how to build strengths, inner strengths, and how to cope with the situations which is ever evolving. We are all in a very difficult situation now. So there is a lot of things that we can do for the young generation of today. I'm also a mother of two children who are in their 20s, and I bring a lot of experience and skills with me, and hopefully I will be able to answer your questions to the best of my ability. Thank you, Vidya, for inviting me today.
Thank you very much, Dr. Shobha. Thanks a lot. And next, could I ask Dr. Kausa to kindly unmute and introduce yourself, please?
Hi everyone, I'm Kausar. I'm a friend of Vidya's. I'm a consultant psychiatrist. I live in North Leeds. I have two boys, one 13 and one 18. As a consultant psychiatrist, I do see a lot of adult mental health issues stemming from adverse childhood events. And I think what Vidya said struck a chord with me because if we help the children from a young age, hopefully we can try and minimize the mental health issues in adulthood. Some of it may be out of our control, but some of it may be personally applicable to us as mothers and as caregivers even. I can't say that I'm very successful in bringing all them skills that I learn in workplace to my home because I have had my share of mummy failures. I've had my share of temper tantrums. But I try. I try. I think trying is the key. So I hope I'll be able to answer some of the questions. Um, may not be able to practice. I hold my hands up, but at least I hope I might be able to impart some wisdom that I have learned in my workplace. And thank you, Vidya, for inviting me to this brilliant chat show where I've got to meet so many nice people. Thank you.
Thank you, Kausar. I think you're very right. All of us have this mummy, guilt. We all go through it at some point in our lives. If someone says they haven't, then I really have to, I'm skeptical about that. I'm sure all of us go through that. Yeah, we could have done something better. And okay, next, could I move on to Dr. Mahima Mohit? Please, could you introduce yourself?
A very good morning and good afternoon to everybody across the globe. I'm Dr. Mahima. I'm an endodontist by profession, so I'm neither a pediatrician nor a child psychologist. But yeah, I have a big degree of being a mother and a parent. So I think that suffices a lot of, understanding. When we were young, our parents used to tell us many things which we used to find very wrong or we used to think. So everyone there's a saying that once you become a parent, you will understand your mother or your parents. So that's what I'm going through right now. What's different with me and all the other panelists is all of them are blessed with the sons, and I'm over blessed with a daughter. So I have a little different thought process maybe of raising a girl child, because I think all of you have boys, so this will be a little different. And I'm a professor in a dental college in Dharwad. So we interact with kids and students on day-to-day basis. That gives us a lot of perspective of what the younger generation or the millennials, what they call themselves, are. So I think that's a big, experience by itself to deal with kids on day-to-day basis. Thank you, Vidya, for inviting me to this show. And nice meeting such senior people and such lovely people on the panel.
Thank you very much, Mahima. Yes, you're the one with the only girl child. I think Shobha's got a daughter. Amongst us, she's got a daughter and a son.
Yes, I've got a daughter and a son, so we'll have the
best of both worlds. Unlike the rest of us, I think the three of us, Saraswati, Kausar, and myself, we've got two boys. It's a boys' camp. But you're the one with the only child, so you're still unique in its.
Another one.
Yeah. So moving on to the show itself, I think I'll start with Kausar, Dr. Kausar. And could I ask, what is resilience? I mean, we're talking about resilience on the show. What is resilience itself? And you need to unmute yourself, I think.
Yeah. I think for the purposes of this talk, I think I'll be focusing on mental resilience. I mean, we all know about physical resilience. We all know about Darwin's theory, survival of the fittest. I think it's applicable to mental resilience also, in that people who are able to adapt to trauma or adverse events seem to fare better in life. So resilience, by definition, is the ability to adapt and seek support and overcome those adverse events very, very quickly. And I think as a part of, as the show progresses, I think we're going to cover, what can help a child develop, that resilience.
Okay. Yes, I think mental resilience probably is key now, especially in this time of, drastic events happening all around us in the world. I think it's key even for adults to have that mental resilience.
Yeah, it's never too late.
Okay, I'm going to move on to Dr. Shobha. Dr. Shobha, as a pediatrician, how would you define resilience, and how do we particularly recognize a child who is in need of help? What are the signs that we have to look out for?
Thank you, Vidya. Resilience is what I call it as adapting to what Kausar said. I do agree with that. Mental, physical, emotional resilience. There are a lot of things that we can talk about. And it's more, if you look at mental resilience, especially with World Mental Health Day coming this week, is 10th October is World Mental Health Day. So we need to look at how we protect mental resilience. It's to go with the flow and to be able to adapt to circumstances. So when I teach young budding doctors and students, we talk about bamboo versus the oak tree. The oak tree stands mighty and tall. The bamboo is always flowing with the wind. So it's like you flow with the flow, go with the flow, is what we say, is how you adapt yourself, because change is something which is always happening. Change is not, it happens today and doesn't happen tomorrow. So every day is a change, and how we go with the change, with anything, with the environment, with our own selves, our body, our health, and how we adapt and tap onto the inner strength, because we all have inner strengths, and how we tap onto that is what is called resilience. Now, how do we identify that in children? Children, I find, are very resilient compared to adults, compared to even teenagers. So the young primary school child, they are very resilient to some extent. And as they grow older, there are a lot of factors which come into play which might affect the resilience. But they may present in various ways, either with physical symptoms for which there may be no underlying cause to explain the physical symptoms, or it may be other things like behavior. And whenever a child presents with behavior difficulties, it's more of a symptom of what is going on in the child's mind, because the child cannot express it. So there are different ways. It may affect the learning, it may affect their friendships, it may affect various other things. So we have to look at the whole picture of the child when we look at resilience and how they present.
Okay. Let me move on to Saraswati now. At primary school level, I think Saraswati, you're muted. You might have to unmute.
Oh, I have unmuted.
Okay. At primary school level, what traits does a child have to possess to be resilient? What is the requirement there to be resilient? In the sense, at primary school level, what would be seen as resilience, and what should a child ideally possess to get through those formative years? With your teacher's hat on, what would you advise a parent?
I spent many years being in the early years unit, which is the child's first interaction with, sometimes if it's the first child, it's the family's first interaction with the educational system. So we get to see resilience and we get to see lack of resilience. And when a child first enters nursery, when it's over 3 years old, not quite 4 years old, it's very difficult to separate the child's resilience from the parent's resilience, because they've all been a unit. Certainly as primary school teachers, we don't expect traits to exist. It's because we see the child as the child is. We don't have preconceived notions of what the child is. But most often we find, if it's a good nursery, if it's a good setting and they have experience, it's very scary when you think you're 3 years old, you've always been with mommy or grandma, and all of a sudden you're with 25 other children. It's very scary. So what Shobha and what Kauthar and everybody else was saying, resilience is about adaptation, about actually, well, I'm also a linguist, I've got another hat. And the word resilience is to do with elasticity and flexibility. So when you're thrown into a completely different atmosphere, how do you adapt? So I think a child who is used to different environments beforehand usually finds it easier. We make it a lot easier by having prior visits. We don't one day snatch the child from the mother's lap and throw him into the classroom. All of you probably have been on day school and then stay and play, whatever. But a child who is trusting, a child who is willing to give things a go, is usually resilient and fits into the school easily. In a batch of about 30 intakes, we usually don't have any more than 5 who carry on screaming after 1 week. But that would be somewhere like our benchmark. They all wet themselves, they all cry, they all stop. But I think by and large, the children are a lot more resilient than the moms. So we often have a member of staff outside to stop to wipe the mom's tears and give her a cup of tea, because the child, after 5 minutes of screaming, usually starts playing. And it's the mom who carries on wailing for 20 minutes. So when you ask about traits, it is really an adventurous child, a child who's used to dealing with different adults, dealing with different scenarios. The more, but if the child hasn't had that experience, we give it to them. Not the end of the world.
Okay. Yes, I guess in many ways it's the parent, probably adult resilience is probably lacking there.
It's
I
as
think,
starting nursery is as painful as giving birth for both the child and the mother. It's a big break. Starting nursery, starting university, both. I cried both times. Never mind my children.
yes, I guess that's true. I think it's very hard. I mean, a lot of us are working parents and we just go and drop our child off. And I know there have been many times when I've gone into work thinking with a heavy heart, wondering how the child is coping, how my son is coping. I don't know, I think all of us go through that. But like you say, resilience is important on both sides, I guess. I think that neatly moves us on to Mahima. Mahima, as a parent, how would you describe resilience? What is resilience to you?
Yeah. Actually, what Mrs. Saraswati just now mentioned, it is the parents who are more resilient because kids or children are like flowers, they are the buds, they just start blooming. So they are going to emulate or model the parents or the environment which they are in. They have no idea of, see, when they were in the womb, they were in water. So you put them out, if you put them into a pool, they are going to swim into that pool of water. So they are going to be adaptive to any type of situation they come across. So I feel as a parent, we have to make them used to various different type of environments and not confine them to one picture perfect society or a picture perfect idealist thing, because the world is not going to be like that. So like what you told Vidya, when I used to be, we stayed in a joint family. So I think that also plays a role in building a child's resilience, because there'll be different viewpoints and different perspective of everyone, and the child learns to adapt with her cousins, with their neighbors. The sharing, caring, giving, all these will help you. We need not personalize or idealize our child as, oh, you are the best or you are the, the ideal. You have to make the child feel one amongst every type of a person. And I feel that's when they become resilient. We have seen so many parents, they would, make the kids go or meet only their age of kids. I feel we should expose them to younger people, the elderly people, to every type of a situation, to every type of a worker, gardener, every situation, so that they know that the world is a big platter and not just what they are going to have every day to day life. So I feel we need to expose them to all sorts of situations. And like what you told just now, when I used to leave my daughter and go to the college, all my neighbors, my people in my house, all were homemakers, all stayed in the house taking care of the kids the entire day. So when I used to come back, my daughter used to, tell me when she was 4, 5 years old, Mummy, everyone's mother is at home, only you are outside. Why do you have to go outside when all others sit and take care of their kids in the house? So I used to feel so guilty. And then I started taking her to college to show her, so when everyone there tells, oh, hello, ma'am, good morning, ma'am, hello. When she sees that your mother is getting some respect, has some position, has some value, she starts respecting that. So then she was like, oh, I'm so sorry I told you to sit at home. So you feel, you should expose them to all sorts of situations that will automatically build their resilience. No lecture and no theory will do any good. That's what I feel.
Excellent. That's great. Yes, I think that's a very good point. To expose them to all environments will bring, resilience. Now, moving on to Kausar, with your psychiatric hat on, where do we start as a parent? We all have mummy failure moments, I'm sure, and we all feel we could have done better at some point in our lives. But what should we do to build resilience in children? Mahima has said we have to expose them. Saraswati has said parents probably need more resilience. The children get on with it. And Shobha, of course, has spoken about making friendships. and
Yeah.
behaving and picking up the points when a child needs help. But as a parent, when and where do we start? What do we do with your psychiatric hat on?
Yeah, I think all valid points, Vidya, all valid points, and all of them spoke very eloquently about various angles, as mothers, as parents. Um, I know there's one thing that we haven't touched upon, which I think maybe I want to raise a bit of awareness. Not every child is adaptable, not every child is resilient. There are children with special needs who may not have the same ability as others. And I would particularly want to talk a little about them also. Children who have, I don't know, dyspraxia, ADHD, autism. There are so many other neurodevelopmental conditions where the parents may not be as understanding, and that can affect the child's confidence and resilience adversely. So I think before looking at before looking at the special needs or a child without special needs, I think we have to look at what a children's needs. I think the first and foremost is, the child has to feel secure and accepted by others for what they are, without any special needs. And they should have the freedom to express how they're feeling and also to ask for what they want. I think that in turn, if they feel accepted by the parents, by the peers, then they may then have realistic limits about what they can expect. So the boundaries are also important to say what's acceptable and what's not acceptable. So child may then develop a little bit of self-control, and also they may feel a little confident in making their own choices, because a lot of parents, I'm not generalizing, but I do know of a few parents who are quite harsh and punitive, and I don't think that actually helps in developing a child's resilience, because the child may feel, they may feel, they may internalize that harshness, that punitiveness, and they may not have the freedom to express themselves or ask for help even. So if they are faced with an adverse situation, the first thing they want to know is that they will be listened to, somebody will listen to them, somebody will accept them, somebody will understand that the difficulties that they're going to go through. So it's about seeking support from people who, without feeling judged. So I think that's really important. So if you were to fulfill the children's core emotional needs by accepting them and not rejecting them, I know I'm using technical terms here, yeah, by accepting them as they are. If they are funny, if they are spontaneous, if they want to make mischief, yeah, just let them accept a little bit. I think, Saraswati spoke about a very interesting point. I think it's the mothers who cry a lot. So it's similarly, I think if the parents accept themselves with all their faults, I think the children will also accept themselves with all their faults. And if they are in trouble, I think they will seek help without the fear of any repercussion. I think that's one of the key things for parents to try and fulfill the children's core emotional needs.
Oh, I think that's a really wonderful point. I'm sure the other speakers will like to
Yeah.
accept the child as they are. Is this a South Asian thing that we place more onerous on the child? Is that something we do as an Indian South Asian thing? Is that
I often have seen that. I often have seen that, the parents try to impose their values, or not necessarily bad. Sometimes it's okay to ask them to do
there
certain
is
things.
a
How
balance to be struck?
there has to be a balance
Right.
between, yeah, and being critical. I think a lot of South Asians are extremely critical, or harsh, or have that. The love is very conditional. Only if you get the first rank, then you're good. And they don't talk about what in case you don't get a first rank, what in case you fail, what in case you take a gap year. Not the end of the world. There's still love.
Absolutely. Now, moving on to Saraswati. Saraswati, as a primary school level, what practical tips can you give parents to be more resilient or to build resilience in children themselves?
Um, I think for one, if you're positive, a lot of children who are very anxious because the parents have had negative experiences of the educational system. And so they project that. We project a lot onto our children. If we are nervous about injections, the child is nervous about injections. If we think school is where, I think you talk about South Asia. I mean, there were wonderful points what both Mahima and Kausar made. If your idea of school is hitting with the ruler, when they play and ma'am says this, if that is what you project onto the child is very fearful when you go to school. So don't project. That is one big tip for South Asian parents. The child is not you. Your unfulfilled ambition, the child is not a vehicle for them. The child is a separate entity with their own identity. Respect that. So, and be positive about school, not so positive that when the child is expressing something that they're scared of or anxious, don't poo-poo it. Take it seriously. If the child says the taps in the bathroom don't open easily or something, take it seriously. But on the whole, don't, because sometimes, again, I'm sorry to harp on mothers, but I've been the teacher end of it. But sometimes mothers feel a bit redundant if the child is too happy in school straight away or at university. Okay, so if the child says bye bye and walks off grinning and doesn't even ask for mommy, I have felt rejected. I've been there. When my children went to university, they didn't cry in front of me, they're young men. But then I know they missed us. But don't be needy. Don't feel the child should. Don't feel the child should feel nervous or something, but be sensitive and aware for when the child is really finding something scary. It could be something as simple as they don't know where to hang their coat or, a small thing. So teach them to ask for help and teach them to be physically age appropriate. If they can do their own trousers, be independent in the loo, put on their own shoes. We are not monsters at school. We are, even those of us who are not mothers, we are very child friendly and we are child centric. Okay, but if you have 2 children or even 5 children, we have 30 children in the class. So we bless the moms who teach the children to tie their own, do their own shoes or do their own coats. So physical independence, positive attitude, and treat the child as a unique individual, not as a projection of you. That would be a good start for resilience, I think.
That's great. Yes, I agree with that. I think we have to be letting our children, we have to let go, I think, at some point as mothers. For fathers too, I think fathers these days take a lot of interest in it. It wasn't anymore, not like it was before.
Now that mine are in their 30s, they're very much better human beings than I was at their age. So why should we be so arrogant as to think they're empty vessels and we are pouring into them all the time?
I think we take a lot of
They are
credit.
wonderful people compared to what I was.
Perhaps as parents, we tend to take quite a bit of credit for the child's good.
Or blame.
Well, the good mainly. I think with the bad, we try to blame it on the other spouse. Anyway, Shobha, Dr. Shobha, what do you think positive parenting is? I know people have come out with a lot of points about positive parenting. What would you say positive parenting is?
I think positive parenting will start very early. I would say would start at an early age to be able to be with your child. And I think very valid points raised by Saraswati, by Mahima and Kausar and yourself about let the child be what he or she is. Even in the same family with the same parenting from both parents, you find the children are different because each child is a different person or a different personality. I mean, in my own house, I can tell you that the children are different. But our parenting has to be for the child to be tailored to that. So some things might have worked for your first child, and you think, well, I know how to bring up because it's worked very well. So you think the same thing will work for your second, third, or fourth, how many ever children, but it might differ. So you might have to tailor your parenting to be able to bring the positivity in your child and to make them as flexible, adaptable to this ever-changing world, and that they can be in any part of the whole world is now their oyster. I mean, the whole world is at their feet now. They can go anywhere, and they should be able to be successful, be integrated to that society. Like how, I mean, for us, I'm speaking for myself. We came from India, and we had to learn the culture here, the traditions here, to be part of the not only working life, the social fabric of the society. So for them to be able to do that, the parents have to be singing from the same hymn sheet, because children know right from very young age, one is more firmer than the other. I'm not using the word strict, because it's just being firm with whatever you think is right for the child, but then also to mold yourself to what the child needs, because children question. So the generation today is very different from when I was a child. We were not really allowed to question as much to our parents. Whereas now everything is questioned, have to be reasoned out. And I think as parents, we have to be prepared for that and not be on the defensive and say that I told you so, but to be able to discuss. And as they grow older, as teenagers, they are more, they need still that parenting, but in a different way. And I learned it quite differently, because it's, you think they're still a child. Yes, they're still a child, but they also have their own values, and they're developing their personality. They have their peer groups. They have the social media to fear, which can be very, very threatening for a young person. Social media and what happens in the virtual world is also spoken about in the school. So the children get bullied in schools. There are lots of things which happen. So as parents, we have to be aware of what is happening, and we have to be supportive to the child. And yet at the same time, what I find is this generation, the young generation, are not used to failures. And that's what I'm finding in the fledgling doctors that I work with, because they're never used to failures. So I think we have to be, again, teaching them and talking to them about what we would do about failures, what we would, how would we wake up and do things. Maybe this is not for us. Maybe there's something else for us. Maybe this is not so good. So to be able to be adapt to different paths. And I think that is what we all as parents have to be aware of. And as professionals, we need to support parents. I know Kausar talked about children with special needs. We have a lot of parenting courses and groups for parents of children with special needs. And I think as a pediatrician, I usually signpost them, advocate them for these groups, so that they become aware of how to deal with children with behavior that is challenging, or they might be aggressive and self-harm and many other things that we see in certain groups of children with special needs. So I think as parents, we have to be aware, and there's a lot to learn. I think as parents, we are always learning, and learning as we go along with the child. Everything, right from schooling, right from how to be at a parent teachers meeting. As Indian parents, we always want to do the best for the child, and we used to get coached how by my daughter to say, don't ask too many questions to my teacher. As parents, we like to ask too many things, and how to do the best, what else can we do. I remember asking these, and then I was told off, and I said, don't ask too many things to the teacher. They will not like it. So I think we need to keep learning at every step, and the learning never stops. Even when now they are in their 20s, I still learn a lot from my children. And yeah, I think that's how it has to be. So it's a continuous process. It never stops.
Yes, I think children are beyond, sometimes they're wiser than us.
Yes.
Sometimes, I think. And we can learn from the child as well on many occasions. I think that is probably one important point for positive parenting, to be able to pick up the vibes from the child and learn. So I think I completely agree. And I also see your point. Two children can be chalk and cheese in the same house.
Absolutely.
Two boys, and they are chalk and cheese. One is one way, the other is the other way. And we just have to work around their personalities to get the best out of them.
Yes.
So I guess that's a very important point. Thank you. Now, Mahima, I know your daughter is a very confident young lady. I've met her. I've had the pleasure to meet her. How did you instill that confidence in your child? What did you do over the years? What has been your, strategy, if you like?
Yes, just like Shobha told, or all the other panelists told right now. First important thing, if we have to build confidence in our kids, I feel we should respect their viewpoint. We should respect them. That is the first sign that we are confident in them, and that is a very important point to build their confidence. We cannot tell them, you should be confident. They will never be if we just give them lectures. And what I have seen is I like to, I'm quite an open person, like to give a lot of lectures. I can just go off and talk on the stage. So I've always made it a point to take her with me whenever I go to give a lecture. So it looks as though it's a normal process. Like everyone talks of stage fear or, anything. So whichever is considered a fear, I've tried to make it think that it's a normal thing. It's nothing unusual to go on the stage and talk. So once they see their parents or grandparents or friends just doing such things, they feel, oh, it's a normal thing. So I've never seen her telling me once, Mom, how will I speak on the stage? Because she thinks it's very normal. So I think we should make things make them realize that it is a very normal process. And like what Shobha told, we have to, if we have to make them confident, first step is we have to show them that failure is very, very normal. We cannot tell them that, you are going on the stage or you are going to excel in your class and you have to come first. That will put down their level of confidence, or it will make them always strive for coming first, which will lower their morale, and the constant fear of not being able to excel will never make them excel. So I think you should just let them be and make them realize you just do it. You may succeed, you may fail, but the trying and the attempting is all what confidence is about. So I feel you should respect their thought. If, like she told, tell them, they tell you that the tap is open, you go there, see to it that, it is corrected. They give you some small, we learn more from them rather than, learning little. I feel I have learned so much from my daughter. She tells me things which we won't know about. So unless we respect them, so the first thing in building confidence in kids is respecting them, giving them a listening ear, and allowing them to fly with the thought in them that they can fail and it is very normal to fail. You don't have to excel every time, but make efforts for that. So I feel make it a normal thing of being confident. If you are confident, they see you being confident. So they also turn up to be confident.
Absolutely.
That's what I feel.
Agree with that. And I know a couple of weeks ago, Mahima did a live cookery show on Facebook.
Yeah.
And her daughter did the filming. So it was a very relaxed, she wasn't nervous at all. I don't know if Mahima was nervous.
But she was just giving me tips from behind. Mom, do this, do that. Yeah, so they teach us.
That makes it so much more interesting, and it gives you confidence and makes them look up to you as well, that you're able to do this live without any issues. I think it's a fantastic point. Kausar, we've covered children, primary school children. Now, teenagers, adolescents, I think that's a big, I don't know whether there is a sudden dip. We build all this confidence and bring them to that point, and then I don't know what happens. So, what is your advice to parents with adolescents and teenagers?
I think, again, as you said, teenage years are a minefield for both parents and the kids, because they are beginning to form their own identity. And I think the children are learning to place boundaries. They are trying to internalize those boundaries and the values that their parents have given. And some of them, they may question some of the things that the parents may have told them. They may say, oh, I don't think this is right. Why should this be right? I think it is their way of trying to establish their place in the society, their place within themselves, and forming their identity. So again, going back to a lot of what the panelists have said, it's about possibly accepting that struggle and being a little empathic to them, and knowing that what they're doing is not feeling rejected or abandoned by the children. Yeah, if the child says, "Oh, you believe in God, but I'm not sure I do," and then I think they have to find their own place in this world, and I think they'll have to find their own place in the spiritual world, in the materialistic world, not feel abandon and not get angry with them because they don't listen to you, they don't share the same values. No, I think you just have to let them be, let them grow. Again, guide them gently, but accept the
Keep an
struggle.
eye on them, but not.
Yeah, accept the struggle. And I think we also have to acknowledge that because of the hormones and everything else, they are going to have a little bit of struggle containing their emotions, and their sexuality may be blooming, they may think differently. It's about again accepting, because sometimes it may clash with our culture, with the parents' cultural norms, the parents' values, but accepting that it's okay to be slightly different, and some children may come out to be gay. I don't know, but it's about being able to accept. They may like one set of uh, people, they may not like the other set, but I think it's about supporting, being a little empathic towards the children's needs. And again, acceptance is the key. I think it's about if you accept them.
I've
Uh,
got a comment from a viewer saying, listening to the teen without talking down or demanding or commanding. The child
yes.
still does not open up. What do you do?
Oh, right. The child still does not open up. Then I think you have to look at where is the fault in the communication, because a lot of times if the child, again, I know I keep harping about the child's emotional core needs. If the child feels accepted, and if the child has a confidence that they are able to express their views, the child will open up sooner or later. Yes, it may, some children are a little more closed. Some children are a little more chatty. They might come and tell you. Some children, maybe because they've got special needs, maybe they've had faced adverse events. The last time they tried to open up, one of the parents was quite punitive, and they may have just shut themselves in and thinking, oh, why should I get into trouble? So I suppose it's identifying what is the fault in the communication, where the fault lies, and then trying to rectify it. And I'm really sorry to say this. I may sound very child pro-like, but I think a lot of communication problems between children and parents stem from, I think, parents, because the parents don't open that door for the children.
We
I
think we're
think
doing the right thing, but possibly it's not exactly what is expected in that situation. Yes,
and probably and previous, I think we'll have to look at previous experiences the child had while they are trying to express themselves or communicate with the parents. And if the previous experiences haven't been very good, then the children will hesitate. So
yeah, to talk
you
from.
have to work on that communication and trying to open up the
I
communication.
think Shobha is wanting to say something. Shobha, you might have to unmute.
Just going back to the viewer's question, yeah, the child may have be sometimes hesitant to open up to the parents, which we have seen in both in my clinical practice and with my friends as well. Sometimes it's good to have a good network of people who maybe the child might open up to somebody else. It may be grandparents, it may be uncles, aunties, or it may be even the school teacher, because many of the children in my clinical practice, at least what I've seen is children from very difficult backgrounds. They are more keen to open up in the school, maybe the teaching assistant or the teacher himself or herself. And if they can offer pastoral care in the school, that is a good opportunity to talk. And many schools have this thing about thoughts and feelings, and they write and they have all these things to help the children come out. And it may be the child also has difficulty in expressing, because even as adults sometimes it's difficult to express our emotions, isn't it? Sometimes we find it difficult to say exactly what is bothering us. So we can imagine how the child may also feel it difficult in expressing in so many words. So that is why maybe writing about it, drawing, art, and various other things which might help the child communicate better.
How
That's what I.
relevant is that at teenage years? I mean, I can understand this at a younger age group, but at teenage
Teenagers.
years, I'm not sure. writing and drawing, if I ask my 13-year-old to do that, I'm not sure I'm going to get the right response from him.
It may not be us as parents because, teenagers, as the Kausar said, it's a very difficult time. And when the ego is developing, the child's personality is developing, and the hormones and the social media plays a very, very important role. However, we try to restrict it, or we have to accept it. That is the reality that we are living in. And I think the parents, their child may not be able to open up, but that is why it's important, maybe some groups, or, we used to, when my children were growing up, we had this young dialogue group where the children used to talk about different topics, and we had a very good pediatrician friend who would conduct it. So the parents would not be part of it, but it gave a lot of confidence and ability to discuss, accept other people's views and things like that. So they may be things that we could look at for the young generation of today, or maybe some of them may want to write about it. There's also a worry jar. Some people use a worry jar where they put the worries. The whole family could play a part of it and put the
Set an
worry jar.
example. I think
So
that's
it's a lot of things, like you could, as long as we open up in a, the days are gone where everybody used to sit around and talk about their days and things like that. Those things help, I think, to help the child come out of the shell. It's a very difficult time, and I don't want to be a teenager in this era, I feel. I find it so difficult for many of the teenage children, that especially that I see in my clinical practice now.
That's very valid. Saraswati, you've taught in senior schools, and often teenagers are labeled as grumpy. They're lost in their own world, and like the viewer has said, they're not communicating. How much of a generalization is this? Is this a serious problem to contend with, and is this something we could work on as a parent, do you think?
First of all, I reject the generalization. I don't accept that teenagers are any more grumpy than the rest of us. If I'm in the league table of the grumpiest people I've ever known, there are very few teenagers amongst them. Teenagers are different, like Kausar said, like Shobha said. It's a very difficult time. Their hormones are all over their place. Talking of resilience, the move from primary school to high school is a big trauma. Is a completely different form of like from being in a protected, fairly homogeneous catchment area, you're all of a sudden thrown into a very mixed, it may be mixed race, it may be mixed class, it may be different cultures, it may be ability levels. So there are lots of the two stages of teenager, pre-teen when you move to high school and maybe when you get into stage 3, and then when you're 18 and you go to university, that's again a very traumatic time. And you may find that a child who was top of the class and very pampered in high school goes to Cambridge, and everybody who's gone to Cambridge has been top of their class and they think they're top dogs. And then there are all top dogs in the class and they find it hard to adapt.
I think at this point I must say, Shobha, I know Saraswati's got had a child in Cambridge, and Shobha, your son is in Cambridge as well.
Okay. Yeah, both my children went.
Cambridge,
well, my daughter is still in Cambridge, and my son is still in Cambridge.
So everybody more or less was absolutely cream of the class. So when you find you're in a bowl full of cream, that needs a lot of resilience to realize you know how to deal with that. Yes. Yeah? So they can be moody. They might not be. It's always easier to cuddle an 8-month-old than to be sympathetic to a 14-year-old, because they're not chubby, they're potty, they're smelly. So it is easier. I think anybody can love a dimpled 8-month-old, but you need to be a better person to be able to love a 14-year-old, whether he's your own child or whether he's your pupil. And the other thing I find is that more so, I think in England, schools are there's been a lot of criticism of it, and we've all had training to overcome it. Schools are very feminized environments. There are more female teachers, and what we appreciate is female behavior of compliance and quietness and helpfulness and charm. And we are doing a great disservice to teenage boys when we say, don't be loud, don't shout, sit down, be quiet, listen passively. None of those things are normal for a 14-year-old boy to sit and listen to you spout. Okay, so we have a lot of us, there's a movement in schools to make it more inclusive and not expect boys to behave like girls. Because girls like to hero worship the teacher and say, Miss, you look pretty today. Can I give you a rose? Boys will not do that. Then we say, you're not a nice person because you're not doing that. Okay, we are expecting them to be something which is not natural to them. So I think, like all of you have mentioned about empathy and accepting as they are. Okay, you don't say boys will be boys, so let them be violent. That's toxic male. Okay, I'm not saying you accept bad behavior because they're boys, but accept that sometimes certain boys and certain girls, they have a different learning style. They'd rather do an outdoor activity. Some may rather do it through dramatics. So I don't think that generalization, again, sometimes it's a self-fulfilling prophecy as well. If we expect our teenagers to be grumpy and sulky, they sometimes oblige us by being grumpy and sulky. Okay, so if you normalize, I think Indian teenagers are pretty good actually. I've been mixed with, I've interacted with a lot of Indian, South Asian teenagers in India, and they always, I mean, my husband has had SHOs whom he's carried as babies, and they'll happily say, hello, uncle, in the hospital corridor. They're not embarrassed about that. So I think our family-oriented culture and so I think teenagers are no more sulky than the rest of us. Sometimes, especially with boys, I think we have to put ourselves in their shoes and see, we have to meet them halfway. And when a boy expects appreciation, it's tremendous, because they are gruff, they don't gush, and they don't go on about miss you're this and mommy you're that.
This
But when a boy
question for
expresses, you
Mahima.
have to learn to pick up. Their language is different, their emotional language is different. If they say, I mean, I've had bearded Rastafarian boys say, Miss, you're all right. Now that is a huge, huge, huge compliment, because for him to say all right, it's not the same as you and me saying all right. Okay, they say all right only to very few people. So I think that it's more about us picking up their communication than us labeling them grumpy or withdrawn. I don't know what the others think about that.
Just sort of saying boys will be boys, like you said. I think
Yeah,
that's
boys will
really
be boys.
unfair to do that.
Not, we
Or
don't accept
even
that
a
boys
girl, I
jump
mean,
or
if a girl is grumpy, I think it's even worse because
Yeah.
we tend to judge them and say, oh, you're a girl, you should be polite, you should be this, you should be that.
We need good male role models.
Yeah,
Need good
absolutely.
male role models. Point to their dad, point to their granddad. This is a real man. He cooks, he's gentle, he doesn't hit people. So show them positive role models of male, but accept that males and females sometimes behave differently. It's not, I'm not, when I say boys will be boys, with all this news in India, I don't want it to be misrepresented as saying when they behave badly, you condone it.
That's it.
No, but accept that sometimes boys express themselves in a classroom
In a
situation
different way.
differently from girls. They are
Mahima,
not goody good.
um,
They don't try to please you.
yeah,
You have
correct,
to you have to understand their signals.
yeah, absolutely. Mahima, has your daughter ever gone through that phase?
Oh yeah, ask me. It's very easy to talk, but when we experience, so I have seen her, around 14, 15 years when she was a lot of temper tantrums, a lot of which was not there before. And some events in school which used to be a let go before, now they carried more weightage. Like, oh, she told me this and he told me this. It all starts because they start realizing and understanding this question and answers. So there was a lot of temper tantrums, a lot of moodiness. Maybe I had to take time to become resilient to understand their moodiness. And then we realized, because just by talking, it never got sorted out. Because, when she throws temper tantrums, I used to get worried. I used to land up losing my temper. For such a small thing, why are you creating, issue out of it? So we think that temper tantrums, we can solve it very easily, but it takes a little more effort. So then I started, every free time, we used to start playing some game, which used to have some moral attached to it at the last. Or we used to, whenever free, we used to have some question answer session, which would lead to the, answer. or which would lead to a situation where she will herself is, oh yeah, this is so small. So I realized just by telling them, oh, this is a small thing, they will in fact retaliate. You never take me seriously. This is a small thing for you. And all those, mother-daughter, I think it is said that if your kid has never hated you, you've never been a good parent. So there were those times where, they will have that, you never understand me. And, but slowly, and then 2 months she was with her grandparents alone. And that has also made her a little subdued now. So when you change their environment to some other people, they will be more better than when they are with your parents. So you can, send them to to their grandparents or to their aunts or friends' places, so that they know, and then they realize, oh yeah, my mom was right and my dad was right. Till that time, their tantrums will not just
I think
go
our
away.
joint family system, perhaps, I
Yeah,
think that's becoming more
100%.
and more, becoming nuclear families. And
100%.
yeah, I
I
think
think
that's,
one main cause for losing on resilience is the nuclear families. And, and this is going to increase in the years to come. There is no going back. So this is a very relevant topic which you've chosen today, Vidya,
uh,
because
is Kausar not in acceptance with that?
I don't, yeah, I don't think, I don't think you can blame everything because I think every
yeah,
unit has faults. I think joint families as a unit can have their faults and not,
yeah,
I
no
I
doubt.
don't think you can generalize to say that every child who's raised in a joint family can be, is going to become resilient because they are thrown to all these adverse events. They can actually face a lot of adverse events in the joint family system. Let's say a girl child is dark in an Indian family, and maybe her cousins are fairer, and then she may get
Agree.
frustrated. And so years before they develop the resilience, they are so
Yes.
adversely affected by all the negative comments by relatives. I'm sorry, I know. We like to give a very rosy picture to what's gone on, but it
No,
can
you're
get
right.
worse.
Absolutely right. And I think
Yeah.
comparison is the main cause for, a child losing out on his confidence. Is you don't have to compare him or her with anybody, good or bad. So that is the
I
one of the
think,
major.
yeah, absolutely. I think comparison, and we are all guilty of that. I've said that as a parent in this day and age. I've said, how much did Aslan get in the maths test? I've asked that question. Okay. Did he also get 100%? Oh, okay. Are you in the top set for maths? I think we are all guilty. Aslan is Kausar's son. So we are all guilty of that. I think I have to. Sometimes I think to myself, I'm being really stupid here, but I'm a mom. I've got a question. I would like to ask how important it is to have social skills in a child, and how to refine those. And shall I hand that to Saraswati, perhaps? Because social skills is something that you deal with all the time. You'll have to unmute yourself.
Trouble to unmute. Yeah, I think it's unmuted now.
Yes,
Yeah,
absolutely.
yeah. Yeah, social skills are paramount and they don't have to be perfect. I mean, speaking with my early years hat on, if you've already done everything, there's nothing left for us to do. So we accept that it's work in progress. Uh, Social skills are built when they come into school and they mingle with other children. Children who have been to other daycare or sure start, sometimes they have children from joint families again, or uh, my children had very good relationship with their extended family, although it was not technically a joint family. So you can live under different roofs, but still have an interaction. And sometimes that gives you space. About social skills and South Asian parents in particular, I think especially I've noticed this with newly arrived um, both parents are professional, very high achieving in school themselves. They have a disproportionate stress on formal academics, literacy, numeracy. So there is, when he's 4 years old, I don't really care if he can do quadratic equations, if he cannot zip his own pants. Okay. If he cannot share his toys, if he bites other children, if he doesn't know to feed himself, those are the social skills what is defined in early years as learning how to learn. So what we teach in early years is how to have a positive attitude towards learning and towards learning by interacting with others. So really somebody who knows all their multiplication tables sitting in a room alone is not relevant to anybody. If
So
they
how
can,
do you develop it, do you think? Is it
you
sending them
can
to
develop it
various...
by sharing at home as well. And by praising, you praise kindness, you praise sharing, you not in a very clunky sort of preachy way, but you don't only say, clever boy, you've done your 6 times tables. That is only one piece of the jigsaw. If somebody is being kind, you appreciate that there are different skills that make a good child.
Okay.
Interacting with people, and the other thing I find with South Asian parents is also accepting of other people's racial, cultural attitude. If you learn to mingle, the more you learn to act with other people and not want to be top dog all the time, that really helps the child, because there's nothing, you have not lost because you're not the leader in that particular group. There is a place for everybody in the team. And I think as parents, if we teach them, it's quite a nice thing to be part of a bigger picture. There's no shame in not being leader all the time because you develop it that way. Uh, I think that's what you got.
About the object of discussion coming behind
So
Mahima.
yeah, I think social skills, we have to appreciate them as important as maths. We should not obsess about picking reading level and maths level. At a very young age, it's much more important to know how to interact. Good manners, sharing.
We've got a question on that, so I'll come back to, I'll revisit that. I'm just moving to Shobha for a second. Are children under more stress these days, do you think? As a pediatrician, what's your take on that?
Yes. I'm seeing more and more. I've been a pediatrician for many years, and over the last 5 or 6 years, I'm seeing children as young as 8, 9, 7 even, with anxiety, with stress. It may be related to events happening in the house, and it may be other things happening at school, or it may be social media again, because even young children have phones and they have Facebook and everything else. So we are seeing a lot of stress in very young children, and it is a bit of a worry to why are these very little ones getting so stressed at a very young age. I mean, are we doing is it the society, is it the environment we live in, is it the food that we eat, or what is it which is contributing to so much stress levels in very, very young children?
Young children.
I mean, stress we all know is useful at some times. It's like what as man has developed the flight or the fright response, isn't it? When we have the lower parts of the brain are more active, and so you just act impulsively. But at the same time, you also need your prefront, the front of the brain, or which is called as a prefrontal cortex, to be developed, to be able to do your executive memory, to do reasoning, to judging and everything. So if you don't have that part developed, then it's always the lower part of the brain which is firing, which is called as the bottom up response, which is the stress response. And we find that more and more. So children are impulsive, children are all over the place, climbing on furniture, climbing on walls, and we are trying, we try our best to find out holistically how to help these families, what is going on in the family. There are a lot of family centers, family support workers, which work with the families to find out, how to help children.
Excellent. Mahima, you wanted to say something.
Yeah, actually, I would add, you had just asked Saraswati about the different ways in which social skills, you can develop or improve on a child. So this I have learned, or it's a tip which I can, share. You make your kid read a lot of newspapers, read a lot of books, whichever book they want to read. What happens is their inquisitiveness and curiosity to the outside world increases. So by reading skills, I've seen my daughter being able to communicate with any age group of a person, and this is a very important way in which their social skills will develop. So she talks to my colleagues when I won't know of topics. I will be sitting silently and they will be talking of the recent Bollywood, Hollywood songs, or history, mythology, any topic under the sun. So reading is a very important, habit which we should inculcate if we need their soft skills, social skills to
Yeah.
develop. I feel it's a very simple but very
It's
effective.
simple and easy
I agree.
method to go through.
Yeah, I
Excellent.
agree. You
Thank
can
you.
then find common. You can then
Yes,
find common themes when
thing.
you're
Yes,
in age groups, and then
exactly. Yeah.
practicing that, they also develop confidence. Like,
Exactly. So, like what Saraswati told, learning tables and sitting in a room, they are just not going to be able to communicate with the world. So they
Absolutely.
should be aware of, what is happening around, then they can communicate. So
Okay.
reading habit can be made a very important thing to inculcate in kids.
Yes. Excellent. Okay. I've got a question from a viewer. So I think this should be Kausar's question. I'm confused. Without comparison, how do you create a role model?
you create a role model by being a role model.
Absolutely.
You cannot compare a child with another child. You show the child what you want. You demonstrate the qualities in yourself that you want your child to grow with. If you
I
want your
agree
child
with that on the subjective things like kindness or, that you can role model. But what about the objective things? Because to a
to
South Asian parent, being top of the class is important. That's where the comparison comes. You go and start comparing, oh, so and so did this and you didn't. So, how
yeah,
do we deal with that?
I think it's not the child who has to deal with it. I think it's the parent who has to deal
Parent,
with it. As Saraswati said, not everyone can be the top of the class. If you've got
absolutely.
30 children, not every child can be in the top of the class.
Yeah. We have to
Yeah.
have the bottoms.
About it's about taking a step back as a parent and looking at what's important in life. Do you want your child to, I don't know, maybe achieve great, achieve academically, and then move away from family? Is that what you want, or what are the things that are important in life, and what are, where things are
I
acceptable?
suppose we have to provide opportunities for them. We
True,
have to give them the confidence
you have to give
and
them the
stay
confidence.
with them through their, growing phase and
Yeah,
be patient, I think, not
yeah.
lose the plot like a lot of us, you know.
And a lot of I think I'm probably speaking for myself, but a lot of people who are on the show are sort of high achievers, and they probably their children are high achievers. So I think achievement probably is less of an issue here, but rather the parents' expectations, and actually toning down the parents' expectations from the child.
Expectation. That's true. I think everything, our expectations, yeah, well, out of anything, you want something, your gardener comes to do some jobs in the house, you set the highest expectation, it doesn't get done. And
Yeah,
then, everything, not just children. I think we are, as adults, we need to be. I think that neatly leads us to the next question. Again, I think I'll give this to Kausar. Sometimes, because you're a psychiatrist, sometimes children grow up to be insecure adults for whatever reason. It might have been poor parenting, it might have been the circumstance. At that stage, do you think parents still have a role in an adult child to instill resilience? Adult child is a very odd word, but as an adult, they are still a child to the parent. So, is it possible to instill resilience at that stage? Is there
yeah.
anything we can do?
As many I know South Asian parenting may have its flaws, but the one thing that I think is very positive in South Asian parenting is that we retain those ties with adult children. I'm in my 40s and I'm still a child to my parents. I still have that, my place in that house is one of a child. And I think it's really healthy because you're not the parent all the time. You're able to be the child, you're able to be the younger sister, you're able to be the niece. So I think it's healthy to be able to take on those roles. And for that same reason, I think parents can still shape, yeah, for whatever reason. Parents may not know how to have how to raise a child, or they may have had mental health issues, they may have been very stressed while raising the child. The child may have become very underconfident, poor attachments as children. But I don't think it's ever too late to start, because relationships are dynamic. And, a child who may be very underconfident, if the parents start to employ those methods, even in a later life, I
Yeah.
think that child can become resilient. Otherwise, you have so many people seeking therapy privately as adults to turn their life around. So I think if the parents can do that, that's even better, because it promotes bonding and it promotes confidence in the child, emotional confidence, I would say.
Okay, and Saraswati, same question to you. What would you see the role of the parent is when the children are grown up? Because you have adult children. How can
Uh,
you make a positive impact as a parent even when they are
I
adults?
think what Kosa says is very right, that we are often, sometimes it's horrible being sandwich generation, but sometimes it's one of the perks of being South Asian, that you are in the sandwich, that you can go into the role of the child or the parent. One thing is to be quite upfront now that they're young men and one of them is medical and the other one is in finance. They hold responsible posts. They are mature adults and you treat them as mature adults. So we put our cards on our table and said we made some mistakes. And when we parented, sometimes both their dad and I, we were desperate not to repeat what our parents did to us. So we were in a very defensive way doing the opposite. Then we made some mistakes of our own, which were not what our parents made. So at all times we did what we thought was best for them, but we didn't always get it right. And before this show, I talked to them, and it was very gratifying to know that overall they thought we were okay. We didn't make too many horrible mistakes.
Yes, that's a good one.
And so I think, yeah, despite my parenting or because of my parenting, they turned out all right. So I think it's important as adults not to be overly defensive. And then if you've made a mistake, it just makes it worse and worse if you say what you did was not wrong, because they are on the threshold of parenthood. Within the next few years, hopefully they'll be parents. And it's time to clear the board and say, these are the things your grandparents were a bit odd about. These are the things we were a bit odd about. We all did it with your best interest. And a young lady I spoke to said, we need to understand and let the child define his happiness, because we have a definition. We are doing this for your own good. And that good is our definition of good, may not be their definition of good. So we need to give them ownership beyond a certain age. We need to give them ownership of their own happiness and their own ambitions and their own path in life. And it can be very tense sometimes. You're letting go the stabilizers, but you have to do it and live with the consequence. I think Shobha wants to
I have
chip
a question for
in.
Shobha as well.
Yeah.
Is just this is a question that I've been, kind of thinking about, and you mentioned it as well. Is resilience inherent, or do we cultivate it over time? Is that something that happens to us? Can it be cultivated, or is that on a personal level, as a parent? I'm talking as an adult, as a parent. Am I able to cultivate it?
Yes. Yes. Can I just go back to Saraswati's point just briefly before I answer this, Vidya? I think Saraswati has and Kausar have very valid, pertinent points of how, as parents, as grown-up adults, how we still go back to our parents and learn a lot. And I personally, from my own point of view, I still learn a lot from, as an adult, I've been learning from my own mother and from my grandmother. As long as she was alive, she lived up to 100, and she had gone through lots of things, in her life. She lost her daughter, but I could still see the smile on her face, and she would continue working, praying, and going about her normal jobs. And same thing with my mother. She was not technically savvy, but when my father got a stroke, she learned how to do banking. She learned how to do WhatsApp and take pictures and send it to people, to the doctors and things like that. So I can see how people have adapted to the circumstances that they were given. So I think so that relates well to the question as, are we born resilient and can we cultivate? And I think it's both, because some children, as we see, have got a lot of resilience. Maybe they've got the inner strength the genetics, the genetic milieu interior in them, which makes them more resilient than their brothers or sisters or cousins or friends. But there are others who might, in the same family, who go through the same adverse circumstances. One child may behave differently to the other. Whereas I think we also, if we have mechanisms to develop, like what we have discussed this morning about positive parenting, about the school giving support, the community, the different groups and various things like scaffolding of the parents, grandparents, the extended family, all these offering support, we can develop resilience as a true, as one of the qualities, along with kindness, empathy, gratitude, and other qualities that we expect in, or which we expect in human beings to help each other. Resilience could be a quality which we developed, and as adults we all develop that, because if we all will, as human beings, we will come across illnesses and treatments and maybe surgical operations, this, that, and other, and how we adapt to that. And I think that is how resilience can be cultivated. And it could also be cultivated by anchors, like maybe having a spiritual anchor, or maybe a social anchor for us, maybe things like mindfulness or yoga or any of these things which help and build resilience. And I see that in my the client, the parents that I deal with in my clinical practice. They have a child who's born with a lot of disabilities, and it's like they bereave for the child, the normal child that they all wanted, you know but then they accept this child, they learn, and they build their life around them. There's a very good YouTube video about how to deal with a child with disability, which says, I had the ticket to go to France, but I reached Holland. And how beautifully they experience that, how beautifully they experience this new child they have with us, the new groups, the new the networks that they build, and they learn about the condition. Some parents become champions of that particular condition, and they support other parents. So I think it is a bit of both. If you have the question of nature versus nurture, it is both really. So it is the genetics as well as the environment, and how the environment can also shape genetics, because
Yes.
a lot of things will change the genetic material. There's a very good book on epigenetics, how things can change, alcohol, drugs, the toxic trio can change the genetic material. Similarly, by doing yoga, meditation, and things regularly, they have not only shown changes in MRI, in the brain scans, but also changes in the telomeres of the genes and the genetic material which changes. So I think it's both really. You can
Yes, so we
cultivate it.
still have hope even in
Yes.
adulthood. That's good. I'm conscious of the time, so I'm just going to ask Mahima about. Mahima started a YouTube channel, and she's a parent blogger. So I'm just going to ask her to quickly tell us about it. What made you do this, and what is it that you do in the channel? Please.
See, the first thing, if you have to ask me truthfully, what made me do this is this lockdown period, when we have all the time to think of, things to make ourselves active during this lockdown period where we can't go out. So it was a very casual thing. I just started talking to my daughter one day, and they have very strong viewpoints, the kids of today. Like, if I don't know, when you or Vidya, you or me were 15, 16, we didn't know which field we wanted to choose. We didn't know what we wanted to become. We just gave some entrance exam. We, landed up
Yeah,
becoming
we went
dentists.
with the flow. That's all.
We went with the flow. But today, they know what they want to do. They have some fixed ideas, and social media is a very, very, like I think Kausar mentioned, or every panelist mentioned, that today's world, social media has a lot of influence, good as well as the negative side.
Yeah.
So we have a kids mother kid group in WhatsApp. So there used to be a lot of question and answers happening in that. So one day I just casually asked my daughter, Disha, let's make a video instead of me writing it down and sending it across as my viewpoints. And we just made a video, one or two videos on a kid's perspective and a parent's perspective, because we just talk of generation gap. We've heard people talking, but we've never heard anyone, or we never make an effort to close that gap. So this is just a small effort to close that gap, understand their view and our view, because how we feel that our viewpoint is so important, their viewpoint is equally important. And when you listen to the talks, you realize that their thinking level is a way ahead. And one important thing I take from the kids is a very important thing, the art of saying no, which I think at our age and at our times, it was very difficult for us to tell a no for things we may not have liked, but just because our parents told, friends told, we just told yes to be very good in the society, or log kya kahenge wala thought. So we wanted to fit in, and then the repercussions are very, on us, and we would have wished we would have told no.
Done
So
something.
today's kids have that, and this topic of yours, the resilience, is the minute you tell no, you break that and you help yourself to be more resilient. So like what Saraswati told, in dental materials, we have resilience, the elastic, material of it. So there, the resilience comes into picture. And I think, so that's the thing with mother-daughter talk just turned out to be a, YouTube talk, and it became quite video, and it became quite, everybody
Popular thing.
appreciated it and liked it because it was heart to heart. And it was on a very important topic and a very casual way.
Okay.
Yes, I think Saraswati wants to tell something.
Yes.
Just very briefly, is it mute still? No.
No,
Can
no,
you hear me?
fine. Yes, we can hear you.
Yeah. It's just you need to learn to say no and also to take no. That's also resilience. Sometimes in life you'll hear the word no. You have to deal with it. And how to deal with
Absolutely,
it
yeah.
in a positive way, that's also part of positive parenting.
Absolutely, yes.
Okay. And Saraswati, one last question for you. We're coming towards the end. What is the school's role in working with parents and building resilience in children? Especially in the United Kingdom. I know, well, in India as well, I don't know what the role is in India, but I can only speak from the United Kingdom's aspect. So does school have a role? Do you have that as part of the curriculum, building resilience? Is that something that's discussed?
Very much so. Very much so. Building resilience. There are schools that actually have something called a failure week, where they celebrate failure and we learn to see failure as a stepping stone to success. And a lot of South Asian parents have a lot of issues with that because you don't know the F word. You're not allowed to fail. So, accepting that the school has a big role, but remember, you think of the number of hours spent in school and the number of hours spent at home, you cannot run away from your responsibility as parents. The school is complementary. Okay, you cannot scapegoat the school for something that you're doing differently at home. So the child is at the center of it. So it's not a competition between school and home.
Complementary.
They are complementary. As parents, what you can do is to be assertive. And if the school is doing something which you question, you go and question. But I think we have a disproportionate representation in aggressive instead of assertive. So you go and ask, like all the panelists have mentioned, question it, but you don't go in with this hostile thing saying, what are you teaching? He can already read this. Why are you teaching him this 3-letter word, whatever. So you put it in a way that doesn't, the child's heart breaks when there is a hostile confrontation between school and home. So both teachers and parents have an onus not to let that happen. Work together. It's like being father and mother. We're two halves of it. And the more we work harmoniously, we have our differences, we talk them through in a civilized way. That is the best for the child is at the center of it all.
Perfect. I think that's very good advice. We've got a comment. Winnicott described rather the perfect parenting children need, good enough parenting. And I think parents should aim for that and take reassurance from that.
Yes.
So that's something that's come out of that. Can I just ask the speakers to summarize a couple of points each, please? Just summarize what you've told us, because we've had a very lengthy discussion, lots of very important points. And I know Dr. Shobha said she's going to do a little meditation to ease off this at the end. So can I just ask, start from Saraswati, just a couple of points to summarize what we've spoken today.
Okay.
Yeah, you're muted. Yeah. Fine.
Okay, I think primarily let the childhood is a valid stage in itself. It's not a preparation for anything. It's not a waiting room. So enjoy your child's childhood and value it. Each child separately. If you have 6 children, enjoy it 6 times, and don't try for perfection. Just go with the flow. And there's a difference between supporting and pushing. I think South Asian parents, particularly, need to walk that thin line very carefully. Don't abdicate your responsibility, but don't take over.
Perfect. Thank you, Saraswati. Kausar?
Yeah, for me, I can never say this enough. Communication is the key. Communication between parents and the child. Please, please learn to communicate, and please try to love them unconditionally, with all their faults, and accept them. And I know I went off. Apologies, I had turned the video off because I was searching for a book which I had, which I can't show you. But if anyone wants to read, there's an incredible book. It's called Incredible Years,
Yeah.
a troubleshooting guide for. Can I share the screen? Do you think?
Yeah, you can share the screen.
Yeah.
Yeah.
Yes. Application window, no, Chrome tab. I will have to look at this. This is a practical thing for parents. Yeah, this is called Incredible Years, for parents of children aged 2 to 8 years, based on plenty of research by psychologists, which I found incredibly useful. I have used it, I have read it when I had difficulties, and I found that incredibly useful. So if any viewers are wanting to read something, and I have recommended it to many of my friends who had little difficulties with their children, and I have learned to accept myself, and I have learned to accept my child as they are. So, if there's one take-home message that I would give, if you're in doubt, please read this book. And it's lovely. Thank you.
Excellent. And Mahima?
Yeah, I think everyone has summarized it very well. And at the message which came, there is nothing called perfect parenting. So just be good parents, love your kid unconditionally, respect them, communicate with them, enjoy moments with them, learn from them, and teach them. Whatever, inculcate everything good. There is this recent movie on Netflix. I think every parent should see that. Serious Men, a very nice movie on where a parent tries to, put his expectations on the child, and what a failure happens when the expectations don't meet up to the level of the child. So just yesterday I saw that, and so these over expecting from kids, please don't expect. They are a different entity, we are different entities, so we should respect. So respect, love, and communicate. These are the three key points which I would like to share.
Excellent. Thank you very much, Mahima.
Yeah.
Shobha, I came to you last because you were going to do the meditation session as well. So,
I think you have everybody. It's been wonderful hearing Saraswati, Kausar, Mahima, Vidya. Everyone has expressed all the points. I don't have anything else to add except emphasizing all of them are very good. Please follow all the important points that they have all raised. I just want to put a last line, like, be the role model for your child and be a guide, philosopher, and mentor.
okay, I've had a couple of, I've had some questions, well, not questions, comments. Great discussion, and then very learned panel. And also, grandparents are a huge resource, and we should make it a point to bring them here or send them to the grandparents in line with Mahima's points. So we've had some really good comments about everything. Good discussion, thoughtful discussion. Thank you. And value of grandparents can't be emphasized enough. So lots of good points. And Yeah, so Shobha, do you want to show us how we can de-stress perhaps?
We don't have much time, so I'll just do a 5 minute breathing mindfulness. Yeah, breath mindfulness, this is called. So just sit comfortably, wherever you are, across the globe, wherever you are. And if you feel comfortable, you may want to close your eyes. If you don't feel comfortable closing your eyes, you can just lower your gaze to the floor or just one point where you may want to focus your gaze on, and just make your posture nice and comfortable. Spine erect. Hands with your palms facing on the knee, facing upwards to the sky, hands on your knees. And just be aware of your posture. Becoming aware of the feet touching the ground or the chair, wherever you're seated. The points of contact of the body on the chair. And gently taking awareness to your breath. The breath is something which is there with you from birth till we leave this world. You may want to use the breath as an anchor, either at your nostrils where the breath goes in and out, or in the throat, or the abdomen, going out and in. Just becoming aware of the breath, not trying to control it in any way, but being aware of the breath gently going in and coming out of the body. Your mind may be chattering away, thinking about the discussion that we have had today, or what you have to do after this. That is a tendency of the mind. Just bring it back gently to the breath. The mind may tend to wander, jumping from the past to the future. The best way to bring the mind back to the present is to bring it to the anchor of the breath. In and out at your chosen point. Becoming aware of the noises in the environment. Any faraway noises that we can hear. Bringing it to the awareness. The mind will wander. That is the nature of the mind. It is like a monkey jumping from branch to branch, bringing it gently back to the breath without getting annoyed, without being angry. Gently bringing the mind back to the breath. Becoming aware of any sensations in the body, discomfort, tingling, numbness, or no sensations. Just becoming aware of the whole body. The whole body seated on your chair. Feet on the ground. The hands on the knees. Being aware of our breath. Gently going in and out through the point of anchor. Becoming aware of the whole room. Your body seated on the chair in your room. And when you're ready to finish the practice, you may want to gently move your body, shake your hands, and with a gentle smile, you may want to open your eyes. Thank you.
Thank you, Shobha. That was very relaxing. Thank you very much.
Thank you. Thank you.
Thank you to all the panelists for taking time out to come and talk to us today. I think I've learned certainly a lot. And I'm sure the viewers will agree as well. Lots of comments. You can go back and read the comments when we are done. Useful session. Lots of people watching. Thank you, Vidya and panelists. Very informative, and few points were eye-openers. So that is. And yeah, so thank you very much. And I will sign off now. And thank you for being with us today. Take care, all of you.
Thank you all.
Thank you, Vidya.
Thank you. Bye. Thank you, Kaustubh. Bye. Take care.